Hello, everyone. Welcome to FormFest 2024. My name is Allie Benson. I use she, her pronouns, and I am the director of the Data Labs project at the Beck Center for Social Impact and Innovation at Georgetown University. You can learn more about our work at the link in the chat. So feel free to say hello in the chat with your name and where you're joining us from. It's always fun to see who's in the room. We will use the Q&A function for your questions, which you can find on the right side of your screen. Please add them as you think of them along the way, and I will ask them aloud for our speakers and for the recording during the Q&A portion at the end of this session. So we are going to dive right into our sessions. Our speakers will introduce themselves briefly, and you can also check out their full bios by clicking on their speaker profiles. We also encourage you to connect with everyone on LinkedIn. So each presenter group will have about 25 minutes to present, leaving us with about 10 minutes at the end for questions for both groups. So again, welcome to FormFest, and I'll turn it over to you, Amy, Karl, and David.
And I was on mute. Hi, everybody. Thank you, Allie, and thank you for everybody for joining. To build upon the momentum of the savings of over 21 million burden hours in 2023, the Department of Homeland Security, or DHS, put forth the fiscal year 2024 Burden Reduction Plan, which had two initiatives. Today, we're going to be talking about the work we did for Burden Reduction Initiative number 2, or BRI number 2, because we're government and everything's got to have an acronym. My name is Amy, and I am a designer and researcher within the Customer Experience Directorate at DHS, and I was the team lead for this work.
Hi, I'm Karl. I'm a senior creative designer with ECS and contracting for the Department of Homeland Security, and I was one of the form designers and builders for this project.
Hi, my name is David. Like Karl, I also work for ECS. I am a UX multimedia specialist and also a form designer and builder for this project.
Okay. Show of hands or thumbs up or whatever. Who here has worked in efforts to improve government forms in any way? All right. So those who have reacted and raised your hands, you are all probably familiar with how government forms don't always have the same look and feel, and they aren't always accessible to everyone. Such was the case with the DHS headquarters forms, and why BRI number 2 was put into place. So the two goals of the initiative were to create common design standards for the headquarters forms and reformat 75% of those forms per those standards. And TLDR, we did it. In fact, we ended up reformatting 76% of DHS headquarters forms with the form standards we created. We streamlined and made the form editing process more collaborative and ensured that all forms were active and had a responsible form owner. And today, we're here to share how we did that. We'll talk about what worked, what didn't, and what we would have done differently, because there was a bit of that. And first, we'll start with one of the most important things of how we built trust with form owners and how important that was. But before we could build trust with form owners, we had to find them. And this took time, patience, persistence, and detective work. Because when we started, over 60% of the original DHS headquarters forms either had no one who owned them or the wrong person was listed. We fondly referred to our efforts at this time as form hot potato. And here's why. Here's a real example, true story. So we reached out to the person listed as the form owner of a form, okay? That person got back to us and said, "Oh no, I'm not the form owner, but these people might know who might be the form owner." Like, okay. So we reached out to the two people that that person referred us to. One of those people never got back to us, but the one who did said, "Oh no, I'm not the form owner, but here's a group email address. And somebody might there must know who the form owner is." So, like, okay. So we emailed the group email and we didn't hear back from them. So gently nudged and followed up. And then shortly after, we get an email back from the person who had sent us to the group email in the first place, letting us know that they were available to chat at the end of the week. So to be clear, what happened was we emailed the group email, and then someone within that group forwarded the message, because we saw the email chain, to the person who sent us to them in the first place, who was now the form owner. This took a month, and it was not unique in its sort of roundabout nature of trying to get to the bottom of who the form owner was. When we did identify a form owner, we scheduled time to meet with them to learn about them, their forms, and what their experience with editing their form had been in the past. We learned that the form process to have a form created or edited felt opaque and sometimes felt like throwing their form into a black hole. Form owners also said that communication happened mostly over email, and if changes were made to a form, they were just made without notifying the form owner. The process didn't sound very enjoyable, and we began to understand a bit more why, when a form was no longer used or a form owner changed, nobody was notified. And we ended up with all the form hot potato. And it was because, the process wasn't transparent and form ownership wasn't seen as something meaningful or important. It was seen as a chore or something you're voluntold to do. So we changed that and made sure that every change that needed to be made was a discussion, not a mandate. From our very first email, we made it clear that the form owner had the expertise as far as their form was concerned. And that expertise was important, that the role that they had was respected and meaningful. And this was a partnership. We were doing this together, and what they felt mattered. We were here to reformat the form per the new standards, not completely change the content of the form. Although, as an aside, because we built some trust with folks, we were able to make a few content improvements along the way. And we also tailored each experience to the individual. Some people were more hands on and some weren't. And we intentionally adjusted how we interacted with them. After we would reformat a form or remediate a form, which means to make a form 508 compliant, which means to make a form accessible for everyone, we scheduled time to review that form with the form owner in real time. We would have the original form and the reformatted form or remediated form pulled up at the same time. And we would go through every change one by one, line by line, and explain why each and every change was made. We also shared the standards with form owners so they could see why changes were made as well. This form review time was a time we could go back and forth about changes openly and transparently. We didn't always agree, certainly, but we were at least able to compromise. By the end, we'd like to hope we planted seeds for a brighter form future for both form owners and the DHS Headquarters Forms Office. Today, there are new policies in place for form maintenance, and form owners feel more crucial to the process. And now I'll hand it over to David and Karl to talk about how we made the forms and standards.
Thanks, Amy. We started with a broad idea of what needed to be done and progressed from there, and we discovered more use cases as we worked. So we were developing our standards as we were working on improving the forms. Next slide, please. All right, we started with simple guidelines for creating standardized forms, but DHS is so large with many different offices and functions with different needs that it was hard to find a one-size-fits-all solution for some of the form elements. Some branches had very different needs and requirements, like legal forms have a very specific format and flow, and that should be adhered to. And other offices still need to print forms and require wet signatures. So the standards were evolving with the process to meet those specific needs. And through meetings with form owners, we were able to develop solutions for specific use cases. Next slide, please. When we took a look at how other organizations were creating forms within their design systems, and others were putting forth a lot of effort to build forms online, which is great. But due to our unique use cases, such as some forms that still required printing, we had to create a process that would work for all of our customers and not just some. And we were able to consult, though, with the US Web Design System for accessibility requirements, like properly labeling form fields to make our job easier. Next slide, please. Thank you. To address the unique cases, we created a form design system in Microsoft Word. It includes a style guide, a component library, links to accessibility resources, and base documents that have all the styles set up to create DHS HQ forms. And the hope is that these resources would make it easier to replicate our work in the future. And next, David is going to talk about the process of creating the design system.
Thank you, Karl. So you might be asking yourself, why use Microsoft Word? I thought you were a designer, and designers are tied to Adobe in a very intimate way. But it's pretty simple here. So we wanted to democratize form production, as Karl brought up earlier, so everyone could open up their laptop and open up Word and edit a form pretty easily. And that's where Microsoft Word came in. It's a software that a lot of people are familiar with. It isn't too confusing. And we also had to fulfill the requirement of using Source Sans Pro. So that also made Adobe not so great. If we were to do this again, we do not recommend Word for all of its, I guess, malfunctions. But again, this is the best option for our requirements. Next slide. So let's take a look at how this worked under the hood. We have two major documents here that were our working documents. Those are the form standards and the base documents. So next slide, the first piece here is the form standards. And within the form standards, it first started off with the style guide. So the style guide is where we designers chose what is the typography, what do the form fields look like, what are the line widths, all of these things were listed in this document. And from there, we're able to go into the component library. So we weren't expecting form owners to have to read this all the time. They could simply go into the component library where there were filled out form fields that could be dragged and dropped from one document to the next rather easily. And to finish out this document, we also added an accessibility resources. So for anyone who uses a screen reader or needs assistive technology, how do we go from only some people being able to use documents to now this new standard of anyone can use these digital documents? That's where these accessibility resources came in, and how do we make these 508 compliant, meaning that it's really easy to go from tabbing through a document and filling out that document with assistive technologies. Next slide. So all of that then goes into these base documents, which are auto-populated with the margins, the typography, all of these things. So the form owners don't have to worry about it. And it is rather easy. The style guide is just there and it's written down, but the form owners already have this document that makes it really easy to make a standard form. Next. Throughout all of this, though, consistency wasn't easy. Cradle to grave, as we were going from the beginning of thinking that we needed to fulfill certain requirements, and as those were evolving, as Karl brought up earlier, our form owners had different requests and needs, and we needed to accommodate for those. So that proved to be challenging at certain times. And as you can see here in this graphic, we grabbed a variety of forms and what those looked like. These do look pretty divergent in their visual style. However, we were able to have a through line because we ultimately were editing this document and making a unified language. Next slide. So, although we all love to hate on Word, as you should, it was definitely something that was a low tech solution that did have a meaningful impact. And to bolster that claim, today DHS headquarters does use this with 100% adoption rate, which is amazing. And now I will hand it over to Amy, who will discuss how we manage the work.
Thank you. And again, show of hands or in chat or reactions. Who has ever had to manage their projects with a multitude of clunky spreadsheets? Right? 2 hands up. Yeah, so did we in the beginning of this. It was gigantor. And don't get me wrong, like I love me some well-designed, purposeful spreadsheets. I even make them in my personal life, but there's a time and place. And we had a lot of moving parts with this project and needed something more dynamic to help. So we teamed up with our other friends at ECS to build out our own custom JIRA space, which streamlined everything. It allowed David and Karl to know what forms were ready to be reformatted and remediated. It let the forms office see everything we were doing and the status of every form. It allowed leadership to see what was going on at a high level. It took a lot of upfront work of having to make sure everything was set up correctly and getting everything from the spreadsheet in there just the right way. It was totally worth it. And this is how it worked. First, every form was a ticket. All the activity of the form was in there, in the comments, form owner feedback and email content, back and forth between David, Karl, and I. This setup made it so all initiative progress was tracked down to the form. Then there's the Kanban board, which is where we spent most of our time. This showed what we were doing at any given point. Each column on the board functioned as the status of a form. We shared this Kanban board with the forms office so they could always see what was going on and understand how we were managing this so they could use the system afterwards. And last but not least was the dashboard, which dynamically showed high-level stats of initiative progress that we were able to share with leadership. And as a bonus, dashboard also had a dynamic searchable table that functioned as a better, more powerful spreadsheet. And the beauty of this is that this system is reusable and sustainable. And today, the forms office still uses this in some ways. And next, we're going to talk about our lessons learned, because it certainly wasn't always sunshine and rainbows. And so I will turn it over to you, Karl, to kick us off.
It can take a while for a form owner to review and require the right approvals for a form's edits, pass that information back to us, and then repeat those steps until finalizing a form. And we wanted our form owners to feel like they were part of the process, so we tried our best to empower them. And when the form owner feels empowered via consistent feedback loops to make the approval decisions for a form's edits, it can be a much quicker process.
Throughout this process, it could feel as if we were building the plane while we were flying it. No exaggeration. So what we would advise is that whenever you're engaging in a process like this, I know everyone says the word agile way too many times, but I'm going to evoke it this time as well. So like from the onset, like build it with your form owners, do it collaboratively. So you're co-designing with them and you're able to get a finalized product sooner.
Building our standards and forms using Microsoft Word and Adobe Acrobat proved to be a challenge. Both programs can be buggy and a little bit difficult to work with. For example, you can accidentally delete all of your hard work tagging a document with a single misclick in Acrobat without warning as well. And Word will sometimes only change fonts in some areas of the document when you are trying to change everything. But despite those issues, we found a good starting point, and the standards we built in those programs are becoming the stepping stone toward building forms with Adobe Experience Manager with the same design constraints that we have proposed.
Change can be scary, right? So this initiative was change, and early on, we used the word redesign to describe what we were doing, and it invoked fear because people didn't know what that meant in this context. So we changed up our language. We used reformat, and it worked. We didn't use words like design system or co-design. We had and did those things, but we used words people were familiar with to describe them, like standards, libraries, collaboration, and partnership. We wanted a relationship based on equity and reciprocity, a level playing field, right? And by simply changing the language we traditionally use as designers, we were one step closer to that. Finally, we had to build trust with the DHS Headquarters Forms Office, much like we did with the form owners. Once we did, working with folks in the Forms Office was awesome because they had all this institutional knowledge, and we wouldn't have been able to do this without them. So before you try and do all of this from scratch on your own, take some time to learn from everyone around you about what has come before. So you aren't starting right from the beginning, and the seeds you plant together will be able to establish roots and grow. And thank you very much, and looking forward to Q&A at the end.
Thank you so much, everyone, for presenting today. A reminder, we'll be taking questions from the Q&A section of the Audience Hub. So please add your questions now. We're collecting them on our end, and we'll ask them during the final 10 minutes of today's presentation. With that, I will pass it off to Luke for the second portion.
Sure. Hi, folks. It is great to see everyone. My name is Luke Farrell. I'm a senior advisor for technology and delivery at the White House on the Domestic Policy Council, but I'm also a product manager at the U.S. Digital Service. So what we're going to talk about today is about healthcare. So how we, through the Medicaid unwinding process, learned that the best forms are no forms, and how we streamlined Medicaid enrollment for over 5 million people in 1 year. So for some quick background on this work, the public health emergency ended in 2023, and it presented an enormous challenge for states across the country, community centers across the country, and the federal government. And the question we were asked was, how do we re-enroll 90 million Americans who had the need to renew paused during the pandemic for the first time in 3 years? So for many enrollees, this was their first time ever completing a renewal. For states, they became massively understaffed throughout the pandemic, and many of their caseworkers had never processed a renewal. And state systems, as many of you probably know, are old and inflexible and hard to work with. And so as a result, millions of people were at risk of losing their Medicaid health coverage, being able to pick up their prescriptions, go to their doctor, get emergency medical care, not because they didn't qualify for Medicaid, but because of burdensome administrative hurdles, right? The paperwork went to the wrong house. The phone number that you used to call has been disconnected in the past 3 years. And so we were presented with the challenge of how do we renew all 90 million of these people really, really fast and make sure we don't lose anyone, not because of their eligibility status, but because of stupid administrative hurdles. What we found, very fortunately, was something called ex parte renewals, which is the process by which we can automatically renew people for their benefits without ever making them fill out a form. So it's zero burden on the beneficiary, it's zero burden on the caseworker, and it saves the state a ton of time and money. And the way we do it here is by using data on the back end that the state already knows about people and being able to hit data sources to understand, if I can look up Luke's income, if I can look up his immigration status, I'll be able to renew his health coverage without ever sending him a form and making him fill out a 45-minute process, going into an eligibility office, calling the call center, etc. So there was this really special tool for Medicaid as a result of the Affordable Care Act that allowed us to automatically renew people for benefits if we had the right data on the government side to do it. So we then faced a problem. There were huge disparities across the country between ex parte rates or automatic renewal rates, with states that had very similar policies on paper, right? So California and Oregon both said they were doing all the same things to keep people enrolled, but in California, less than a third of people were being automatically renewed. And in Oregon, almost 90% of people were being renewed automatically. And so this results in a huge disparity across states as far as how many people are getting paperwork, how big the backlog is, how burdened caseworkers are. And so it was a real mystery when we first started. Across the country, the ex parte rate was below 20%. Some states were doing a really good job. A lot of states were doing a really bad job. And so we talked to a whole bunch of them, and we found that states needed help implementing. They had these systems that were opaque, difficult to operate. They hadn't revisited the code in many, many years. And so what CMCS, the Center for Medicaid and CHIP Services, USDS, the US Digital Service, and OMB did was partner with over a dozen states, rather 10 states across the country, show up and try to fix those systems to help automatically renew people and get forms out of people's mailboxes, get them off of caseworkers' desks as fast as we could. And then for the other people, which we'll also talk about, who we didn't have the data to renew them automatically, what is the paper process for those people to make that as seamless and as burdenless as possible for them? So the strategy here was fix the automated process so as many people as possible don't go through a paper process, and then streamline the paper process for those who need to go through it. So the way we did this was a little crazy. We showed up in a van in a state capital. We got all of the policymakers together. We got the frontline workers in the room, their technical vendors, the caseworkers, community organizations, and brought together this interdisciplinary team to really say, where are people getting stuck in the automatic process, and should they be getting stuck there? And we were empowering often community groups, policy leaders who knew what needed to happen, but didn't have the skills, the technical expertise to actually get it done quickly. And so that's what our team was adding to the mix. So we would analyze in the private sector what you might consider like a funnel. In sales funnels, you think through how many people are getting churned out at each step of the process. That's exactly what we were doing, but for Medicaid renewals. So you might have 100,000 people that you're trying to renew each month. You're ex parte renewing around 40,000 of them, and you're kicking around 60,000 of them to the manual process. And we would look at every single one of those instances and say, how could we have converted this person to an automatic renewal? Or how could we have gotten them through the manual process? And looking at that whole funnel, ultimately with the goal of minimizing the administrative terminations. And these are the people who are being procedurally denied, not because, again, of eligibility reasons, but because of paperwork reasons. Amazingly, this process really worked. Everywhere we went, we increased the ex parte rate, so the automatic renewal rate, by around 22%. And we actually saw, alongside those increases in automatic renewal rates, a decline in the procedural termination rates of around 10%. And I'll show rolled up statistics for this, but in California, for example, increasing their ex parte rate by 30% meant that millions of additional Californians were never receiving a packet in the mail. They were just being automatically renewed for their benefits. they would get a letter in the mail that said, congratulations, your Medicaid's been renewed for 12 months, as opposed to a 20-page packet that required them to fill out all of their information. And as a result, we saw a significant decline in the number of people who were being procedurally denied that coverage. So it was enormously successful across a very diverse and bipartisan set of states. We went to red states and blue states. We went to big states and small states, rural and urban. And this process where we were bringing people together and fixing systems quickly really seemed to work, no matter where we went, which was very, very exciting. And so this was kind of the automatic renewal portion of the funnel. And again, these results mean that millions of additional people are able to continue to receive their medication, able to get their prescriptions, able to go to the doctor. And importantly, this also means, like in California, we're removing millions of those cases off of caseworkers' desks. And now those caseworkers can focus on the most complex, the most intricate cases, the cases where there might be program integrity concerns. They can focus on those complex cases instead of focusing on the easy ones that we can use government data to complete. So then what happens to the people who were not automatically renewed for coverage, right? Maybe you have a new job, or your family situation has changed. You've had children over the past 3 years, which was the case for many people. Those people we weren't going to be able to automatically renew on the government side. So what the policy was for Medicaid, which I think was a spectacular policy position, again, designed in the ACA and required of states, is that they had to send pre-populated renewal forms. So it wasn't just sending a blank 20-page form. We had to use, again, the government's data that we have about you and fill out the form on your behalf so that you could then go through and make changes where it's necessary, but you don't need to refill out your full name, your full address. You don't have to refill out all of your children's names and all of your children's information if it hasn't changed. If there's a change, you can update the form to reflect that change. But the idea is we're taking some of the burden off you by pre-populating it with what we already know. And so our team, in addition to the automatic work, we also improved all the surfaces that someone might interact with in order to renew their health coverage through the manual process as well. So we did a ton of website relaunches and refreshes for people trying to renew online. We stood up WhatsApp text messaging so we could reach immigrant communities and notify them, maybe if their phone number has changed, but they're still on WhatsApp, notify them in their native language that their renewal is coming due. And we even did small things which made a huge difference, like redesign the envelopes. So in New York, for example, they were sending out blank white envelopes for the entire duration of the pandemic that used to contain a notice that said, your health coverage has been renewed, no action required. And then they began stuffing those envelopes with, your coverage will be terminated in 60 days if you don't take action. But people had been kind of predisposed to throwing out those envelopes because over the 3 years they were not actionable. And so they were seeing a low open rate of those envelopes when they contained information people need to respond to. So all we did was redesign the envelope with big red letters that said, action required, important information about your health coverage, and suddenly that open rate increased a whole bunch, and people were not dropping out of the manual renewal process for missing the mail. So we took a holistic approach to the manual side to find all of those, again, in that funnel, all of the holes where people were falling out, and rapidly doing human-centered design research and launches to close those gaps in those states. And so in less than 12 months, our team again worked across 10 states. We automatically renewed over 5 million people for their Medicaid coverage, which prevented the loss of coverage for over 1 million people. So we expected that at the normal administrative churn rates, 1 million people would have lost their healthcare coverage just because they missed the mail, they missed the phone call, they messed up their paperwork, they didn't send in the right pay stubs, and we prevented all 1 million of those instances. We also, importantly, cut over 2.5 million hours of burden on enrollees filling out those forms across the states, and we prevented over 2 million hours of desk work for caseworkers in those states, which results in millions of dollars in cost avoidance for states as a result of caseworker time that would be spent on processing those easy cases. So this methodology of bringing folks together, trying to divert people to automatic renewals, and then in the cases where we can't automatically renew them, diverting them into different channels manually that are pre-populated, that are easier to use, resulted in an enormous improvement in the customer experience of renewing your health coverage during the crisis that was the unwinding of the public health emergency. And importantly, I'll note, all of these wins will continue long after, right? So this was not reliant on kind of new policy. This was just better implementation. And so for years to come, these people will continue, again, to be renewed for coverage if we have the data on the back end to make sure that they can stay enrolled. So the big takeaways, I know this is not just Medicaid. This can be the case in a number of public benefits programs. For any policymakers or designers on the call, I'd recommend that you really think through, are there ways we can automate eligibility determinations wherever possible, or automate steps or data collection that we're doing on the front end through a form? Does this need to be on a paper form, or can we do it ourselves on behalf of members of the public? And so I think that is like the huge win here is 1 million people have coverage for Medicaid today because we were able to do that. The other side of this is that the government needs to be leveraging the information that we already have on folks, as opposed to asking them every time they need to renew their coverage or every time they're at renewal, right? We ask people to fill out their name, their phone number, their address hundreds of times. We already have that information if they're enrolled in the program. We should not be asking them that over and over again. And that's the case for automatic renewals, and it's for the case where you can pre-populate forms. And so I think, again, pre-population is an enormous opportunity across public benefits, actually filling out those forms on behalf of people and sending them for people to verify and check. And in the case where you can't do automatic renewals, making sure those go out to people. So that's all I got. Happy to take questions, and thanks so much for listening.
Thank you so much, Luke. Fun fact, I was actually one of the beneficiaries of the auto renewal in Oregon. So it's super fun to see how the sausage is made, so to speak. And I know for me, I was definitely sort of like, oh, like that's it? Like waiting for something else to happen and nothing else happened. And it was delightful. So thank you so much for sharing more about your work. So now it's time to get to everyone's questions. If you haven't done so already, please go ahead and add your questions to the Q&A function. And be sure to upvote the questions that really resonate with you that you want to make sure that we share. We'll get to as many as we can in the time that we have left. And with that, I do want to start with one question that I personally have that I think I've seen a lot in my work advancing data-informed policymaking in states, which is that there's the work and then there's the people around the work and the sort of the broader efforts to make those connections, bring people along, get buy-in, and things like that. And I know both of you kind of touched a little bit on what that looked like, but I'm curious if you could share perhaps one aha moment or one key piece of advice that you feel like came up for you in your projects in terms of getting that buy-in and sort of navigating the people element of this work. Luke, do you want to start?
Sure. I mean, and let me know if this gets at what you're asking here, but I think the big aha moment for us was approaching states that had really low automatic renewal rates and saying, hey, your neighboring state has a 80% automatic renewal rate. And you would see their light bulb moment go off. They were like, we didn't even know it was possible to have such a high automatic renewal rate. Like we thought we were doing great cooking here at 8% every month. And I think there was like showing them that data and showing them what other states were doing and what was possible, I think was a really powerful moment for a lot of state leaders so that they could then set a target for their teams and really understand what was possible. And I think we had that moment like over and over and over again where we would show up in a state and say, hey, your automatic renewal rate is super low. Like, you know, it's possible for us to do much, much better. And states would, you know, really get very excited about that. And we would help walk them through how we could get that done. And so I think that was like the kind of data-driven policy making that was really useful. And then same on the manual side, we would say, you know, your website is dropping all of these people off. You know, it's possible for us to do much better. And I think that showing them what was possible in the state context and showing them what other states were doing, I think was a really, really powerful tool that we had at our disposal in our state by state work that was compelling to state leadership. It helped us like draw a target for them, and then it helped us drive the work, which I think was really powerful.
Yeah, definitely. Amy, David, or Carl, what about for you all?
I think I think one of the things that well, I think we talked about it a little bit. One of the aha moments was when we first met with form owners and talked about their experience and about their forms and about them. And we learned that the process hadn't been so great. We learned how to improve it. I think I think on our end, we learned that um, going into that process and like going into the go like once we had like the process and everything together, it made the moment. I guess aha was like it sounds obvious, but like having everything together. So like when we would go in and talk to form owners about the process and about what was going to happen, we went through step by step, just like we did the form review process, step by step, and we had it all laid out. And so it looked like we had it all together. And then by the end of those sessions, people were like, oh, okay. So what do I have to do? And then we were like, just work with us and like share your knowledge with us and like work together. And I think you know, being able to have something like more structured and concrete for them made it less scary for time. Hopefully that answered your question.
Yeah, it sounds like sort of making it very easy and turnkey, laying out the process, making it easy for folks to engage and things like that. Great. There's a lot of like, oh, go ahead.
Yeah, I'll add one more thing too. I think like Amy, to your point, I think that's all right. And showing precedent, whether it's from other states or other agencies or other departments, I think was constantly a question we got. Like, can you show us an example of someone else who did this well? I think was always really top of mind. And then one tool that we used quite often, which I would recommend, is like making leadership feel the pain a little bit. So we would actually sit down with leadership and show them their online renewal form and like have a very painful 45-minute meeting where we are like walking through trying to complete a form online and it being like a very embarrassing experience for, you know, the state leadership who had never actually tried before. And I think that is, again, where you get all those aha moments where you get stakeholders to be like, yeah, we really need to do something about this. And I think that was a really useful tool. I know Sevilla has done that and pioneered that approach. And I think we just found that invaluable. You know, print out the 20-page document and have them try to fill it out has been really cool to use.
We did similar stuff like that as well. Like when we first went through the forms with form owners, like some of the forms would have like 5 to 10 pages of instructions before, like at the back of the form. So you'd have to flip back and forth. And when going through the form, we would ask form owners, so what do you, what is this, what do you need this for? Like, what is this necessary for? And we actually were able to have that because some people, like some of the form owners hadn't even like, didn't, weren't actually filling out their forms or anything. So totally agree, Luke.
Yeah, that's great. There's a lot of sort of more tactical questions in this queue. One of them is around the data that you use to measure burden and burden reduction. And specifically, when it comes to burden reduction efforts like pre-filling forms, how did you manage discussions and trade-offs around protecting PII and data security?
So I'll take each of those in turn, but DHS team, I'm super curious. I know you guys are really good at measuring burden. On the Medicaid side, the way we measured burden was actually pretty coarse. We basically, because we were eliminating forms, it was actually quite easy to do, how long does it take someone to complete this form? And then, you're comparing that to 0 time in an automatic renewal. So the actual like burden estimate, I think, was pretty straightforward. It's also likely an undercount because it doesn't include things like learning costs, calling into the call center, online journeys where people are trying to figure out what things mean. And that was just like pure form completion time. So that's how we measured the burden. On your second question, I think, can you remind me of the second question? Apologies.
Yeah, so it had to do with how you manage discussions and trade-offs around protecting PII, like privacy, data security, and some of those more, important details.
Yeah, so fortunately in the pre-populated forms, the Medicaid regulations cover all of that, and they're pretty clear about specifying like what can be pre-populated, what cannot be pre-populated, what is considered like HIPAA protected information and what is not, for example. So I think a lot of that was useful. We also were verifying people's addresses, so we weren't sending, for example, a pre-populated notice to a household where someone wasn't residing. And so I think that was kind of the balance. But I think that's certainly something to consider when you're doing pre-population is, especially if regulation is not super clear in your area, is thinking through, is this a piece of information that is highly sensitive or is it not? And should be included, or how should we include it, for example.
Great. Amy, David, or Carl, do you have anything to add with respect to the data security or privacy components of your work?
Yeah, I think the one thing that I would add is, and I think Luke explained it really well. Like, really, really be considerate about, w- what PAI you're using, and really ask, do you really need it? Do you really? Like, what is the most essential, like, information that you actually need? Because we actually had form owners that we were working with. They wanted to add, um, they wanted to add things to their forms, and they wanted to, or add extra data they wanted to collect, like social security number, for instance. And the question was always, do you really need that social security number? And if you don't, it's not worth it. It's not.
And kind of in a related vein, could either of you speak to how your work coincided with the back end redesigns for data ingestion and validation?
Sure, I can take that because we thought a lot about that question, because basically the way Medicaid regulation is laid out is you need to attempt to automatically renew someone before you kick them over to the manual pre-populated form that gets sent out. And so when you're attempting to automatically renew someone, you're if you're a state, for example, you might be looking up someone's wage in your state quarterly wage data database that all states are required to collect. Or you might be looking up someone's family status in other information that your state collects. And so as you're gathering that data to attempt to automatically renew with someone, but you can't, and you need to fall back to a pre-populated form, you can use all of that data and pre-populate the form with it and kind of ask them, is this accurate? Is this correct? And then the person can go through and fill out, for example, actually my income has changed. Since this piece of data that you're sharing, my income is now higher or lower, or my job is different now. My job has changed, and here's my new job information. And so fortunately, there was a bunch of pre-populated information that we were attempting to collect during the automatic renewal process that we could then use to pre-populate the form accurately. I mean, also notably in the pre-population, there are so many things that someone filled out at time of application that don't change. Your name, your phone number, your address may have changed, but you can update that on a pre-populated form. And so I think it was a combination that we were pre-populating with both information the applicant provided at the time of their application, and then also information that we may have gathered when we were attempting to automatically renew them. And then the onus is on the applicant. Oftentimes it's like, depends on the state, but it's like a checkbox where they say this is still accurate. And there's a little space where you can say, no, this is not still accurate. Here is my new job, or here's my new income. And so I think that was, we were fortunate where we were able to do a lot of pre-population just because of the design of Medicaid regulation.
Amy, do you have anything to add around the sort of back end redesign requirements with your project?
No, because unfortunately, like we were working with PDF forms, right? And there was a system that the Forms Office uses to manage those forms, but they're PDF.
Fair. There were also a lot of questions around the Microsoft Word that y'all used for your forms. So my question is two-part. One is if you said that you wouldn't use MS Word, so if you could wave a magic wand and use whatever you wanted, what would that secret sauce be? And then two, could you share a little bit more about how you transformed Word into the final product and what that final product looked like?
Yeah, I'm going to hand this over to David and Karl here in a minute, but I would like to say we said we wouldn't recommend using Microsoft Word, but it did work for our purpose, right? It got the job done for what we needed, right? And for what form owners needed, and for what the forms office needed, right? Because now they can take the components we've used and then implement them in Adobe Experience Manager. But so just to clarify, but David, Karl.
Sounds like we maybe lost Amy for a second. I don't know, it just stopped. But I can, I guess, speak to it a little bit, because when we first started, my intention was to build out what we needed in InDesign, because you can move everything very easily to where you need it to be, and also more easily set up components, sort of like what we did in Word. But we had to stop doing that because the access to Adobe InDesign isn't as prevalent as we would like it to be. And also there's a learning curve for using it, whereas most people in DHS do, or at least should be familiar with Microsoft Word. And even then, I'm not sure Adobe InDesign is perfect, but considering what we had as resources at the time, it's at least where I would have liked to start. And I'm also not familiar with Adobe Experience Manager, so I hope that it handles all of this better than what we were using.
Great. And can you expand a bit on the sort of like the transformation from Word into the final product? Did you export that into a PDF and then make it a fillable Adobe? Yeah, just expand a bit on that.
Yeah, that's pretty much exactly what we did. David was a Microsoft Word whiz for us, setting up these documents, and then yes, we exported to Adobe Acrobat, and from there we had to make sure all of our form fields were fillable, set all of the requirements for those form fields. A really fun thing that happened, and I use fun facetiously, was that there was an Acrobat update towards the end of our project duration that changed how you can set up date fields. So we needed to work around from that because they got rid of the feature that we were using, which thank you, Adobe, so much for that. But we were able to figure some stuff out and settle that. And after adding the form fields, making sure that they're all in the right reading order and tagging the document appropriately is time consuming because it has to be done manually. But once you get in a little bit of a rhythm with it, it becomes kind of easier. So.
And do the form owners keep that working document, or does it live in the forms office? And is that something that you would be able to share with the broader group if they're interested?
So the PDF forms and the drafts are all kept with the forms office. The form owners will have copies, like PDF copies of the forms, but all the actual editing and managing of those is with the forms office. But form owners do edit their own forms. And so uh, the Word documents are available. And we actually had one form owner, it was awesome. One form owner who used the standards and used the component library and base documents to reformat their own form. And so we were able to usability test it like at the same time. It was great. Uh, and then the second part of your question was, asking if we can share what that was. And like basically like a copy of the base document or a copy of.
I think it's the referring to the, can we see the Word document that y'all used with the form owners?
Yeah,
And
like the foot.
making templates in words and things like that.
Yep. Yep.
Okay, great. We'll be sure to follow up on that. We have 2 minutes left. So I'm gonna say we probably have room for like 1 or 2 questions. One of the more popular questions was around how or where did you document the form standards or requirements? So Luke, do you want to share more about, or I'm sorry, Amy?
In the standards document in Word. And so all of that was in there. And we wrote them out, right? But it was also important to show, in the style guide and component library, how they actually worked and make it copy and pastable and usable.
And that was like your SSOT, you referenced it everywhere, things like that.
Yeah.
To what degree were the forms like reformatted versus the content itself being changed? And did you encounter any policy resistance for any content changes that you had to make?
1000%. Yes. Especially the legal forms. But we even found like a little wiggle room with those two. And I think that also had to do with the relationships we had built with the form owners as well. So we couldn't necessarily, like, for instance, in some of the legal forms, we couldn't necessarily change the language that was on there, but we could tweak the organization of it. And so kind of how things flowed on a page and how things were organized and grouped together to make the form easier and less of a hassle to fill out. But the as far as the as far as like how, how many we were able to change some content things, and we were able to change some content things by asking form owners what does this mean, like, and when you start going through a form with someone, we would have questions after we reformatted a form. Like, we would have questions for the form owner that we would put aside and mark on there and be like, so this section, what's the like, how does someone do this? Like, what's the purpose of this section here? And what are you really trying to get? And kind of asking those questions, we were able to figure out better ways to get the information they needed and provide a better experience for people filling out the form.
Yeah, and for us, it was a very similar experience on the Medicaid side. Every state was a little bit different, but as an example, we would bring caseworkers in who are on the receiving end of these forms and say, which questions are people messing up? Like people are submitting their forms where they're not understanding the income definition, right? So in one state, caseworkers were like, everyone messes up this income question. So we looked at it and it's very obvious the question is confusing. It's unclear what counts as income. And so we work to like plain language the content in that question to make sure that people are actually filling it out accurately. I think that was a big moment with a lot of states was, yes, we want to plain languages to make it more understandable, but it's also so that you don't have to call them up on the phone and try to get back and forth as to what the actual answer is. And so I think it was very powerful for us to sit down shoulder to shoulder with caseworkers who are processing these forms every day. And they say, question number 9A is the one that everyone messes up. And we need help like actually fixing the content of that question so that people get it right. And that helps both beneficiaries and caseworkers.
Yeah, thank you both so much. Well, I know we're at time, so thank you everyone for all of your great questions. Let's give our speakers a round of applause virtually. Thank you all so much for sharing your great work with us. It's genuinely really cool to hear about what y'all are up to. During our upcoming break, we'll have speed networking. So please use this time, this optional time, to connect with each other and other FormFest attendees. You can also explore other attendees' profiles and connect asynchronously in the attendee tab. And with that, we're going to go ahead and end this stream. But once again, thank you so much to our speakers today and to everyone here for joining us.